Let's take the first of our many calls. Hello, where are you calling from, please? You're on the air.
Hi, from West Hill.
Go ahead.
Yeah, I've suffered from sebaceous acne for the last 20 years, mainly on my back. And I was wondering, I've gone through treatments with antibiotics to get rid of it, cut down on red meats, dairy products, anything producing fat and everything else. And I haven't had a lot of success in treating it. I was just wondering if there's any comments from your guests there.
Okay. For many years, I gave antibiotics for acne. It's not the answer. When you have any chronic condition, it doesn't matter whether it's acne or whether it's migraine headache or whether it's arthritis or psoriasis. It's a question that you either are not getting something you need or you're getting too much of something you don't need. And the things that you need to have a healthy body, you need proteins, you need good carbohydrates, you need some fats, including the essential fatty acids that you get from sardine oil and from cod liver oil and from salmon. You also need them from some of the vegetable oils, and we particularly prescribe linseed oil. These have to do with the integrity of all of your cell membrane. Then you need vitamins and minerals. I know this is controversial, but I believe in supplemental vitamins and minerals, including vitamin C in big doses, also the B vitamins, some vitamin E, vitamin A. In other words, you need a good balanced preparation of these every day. You also need calcium, magnesium, and zinc. Do you take zinc?
Well, I did for a while. I also went on 2 tours of Accutane, which...
Okay, well, let me talk a word about zinc. Zinc is a trace element that is needed to make you resist infection. And also, they've done studies that people who were zinc deficient had more infections than people who did not. But again, you need to play with the full deck, and you need to go to a nutritionally oriented physician who can help put you on a good nutrition program.
How many of these vitamin preparations have yeast as a base sometimes?
Well, many of them do, and if you have this candida problem, why, you may need to get a yeast-free vitamin.
Supposing this man's problem is yeast-based.
Yeast-related. If he's had a lot of antibiotic drugs, why the candida may be weakening his immune system and causing him some of the problems. It interferes with the fatty acids. It's hard to give you a quick answer, but I think that you need some help from a different way than antibiotic drugs. It's nutritional, and you may have the candida-related problem
Would you agree with that, Carol?
Yes, in my practice, when I see chronic acne, especially on the back, I find dairy products tend to exacerbate it. And I think saunas and a lot of exercise. When you're dealing with a chronic problem like this, you tend to find one thing here and one thing there. You have to put it all together in a package, and that way you tend to have more success.
When somebody comes to you with a condition, say a vaginal condition, which has been determined is yeast related, have you ever encountered anybody who's had or who's had recommended a surgical recommendation, a surgical treatment for these
In
conditions?
some vaginal problems, you can have a chronic cervicitis, which is an erosion of the cervix that can be discharging mucus and irritation and a site of infection. And I have seen women have cautery or surgery to treat that.
Efficaciously? I mean, does it work?
No. Well, I shouldn't say no. If that was done, plus a diet, plus the right follow-up treatment, it's the same with anything else. One little bit isn't going to help. You can't cut something out. You have to replace as well.
Okay, let's take another call. Yes, you're on the air with Speaking Out. Where are you calling from?
I'm calling from Toronto.
Go ahead.
Okay, the first thing I'd like to ask is the woman doctor, is she a medical doctor, and if so, does she practice in Toronto, and is there any way I could find out if I could come and see her? The reason I'm asking that is, can a yeast infection cause anxiety-like symptoms?
First of all, Dr. Dean graduated from Dalhousie School of Medicine, and she's in general practice in Toronto, and you can deal with the other question.
Yes. Yes, I I'm actually on Speaking Out and speaking out about this because I have such a patient overload, and I see such a need for the information about this condition to get out to the general public. I'm going to be referring calls to my office to the Candida Research and Information Group, which is based in Toronto, which has study groups and tries to teach people the things that we're touching on today. It's very difficult for a doctor under OHIP and in their office these days to give enough information out in the short amount of time we're allowed.
We have a resource list which we're offering, by the way, a reading list and that sort of thing. Also information about the associations and organizations that are available. But go ahead, about the anxiety.
And then the anxiety. I think Dr. Crook has talked about this as well, that anxieties can be part of the yeast condition, in that certain of these yeast toxins seem to be circulating in the system and cause cerebral effects.
Can anti-anxiety drugs, Dr. Crook, trigger the very condition that might have caused the situation in the first place?
No, I don't think the anti-anxiety drugs trigger it, but I think they're treating a symptom rather than getting at the cause.
Yeah.
Just like if you have headaches due to Candida, you can take aspirin, it may help it, but you really need to get at the cause.
Mm-hmm. Okay, let's take another call. You're on the air. Where are you calling from, please? Hello?
Oh.
Yes, I can hear you way off in the distance. Would you speak?
Am I actually on?
You are actually on.
I may be stage struck. Look, well, my question is, and I'm sure the doctors explained it, but I didn't technically understand it. What connection, if any, is there between asthma, hay fever, eczema, which we've encountered in my whole family and with our children terribly and their grandchildren, and the yeast connection? Is there any?
There may be. Of course, asthma, hay fever, and eczema can be due to pollen allergies, dust allergies, quite independent of people who have a yeast-related health problem. I have especially noted, though, that many of my patients with food allergies, that when they have the yeast problem treated, that the food allergies go away. I haven't noted as direct an association with the inhalant allergies, but I think that anything that weakens your immune system, and the Candida does, makes you more susceptible to allergies. So if you've had a lot of antibiotic drugs, I think it's quite possible that an attention to the yeast factor may lessen some of your sensitivities to the things that are giving you your other allergic symptoms.
Well, our children they were treated by the best allergists and pediatricians and what have you in Toronto, and there was never any connection made at that time, except they were 3 extremely allergic children. It wasn't an emotional thing. Okay. But they did, in the winter they were fine, except they did tend to get, when they got an infection, bad ear infections. So that sort of made me wonder, and our grandchildren are now getting the same thing, very healthy, other than their allergies, which of course is genetic. I wondered whether the ear infections would have more to do with allergies or any possible yeast connection. I've never heard of this before. My dad was a doctor. Okay.
The ear infections themselves do not promote the yeast growth, but the treatment does. I mean, the broad-spectrum antibiotics promotes it. Let me say this about your allergists and what they think. There were a couple of articles in the Canadian Medical Journal about a year ago saying that they didn't believe the yeast connection. It was speculative and unproven. And I can understand that because not many studies have been published in the medical literature, but new studies will be coming out to show this, and we have good clinical evidence. And I make this offer to any physician, any MD or DO who will write to me, and I think Harry will give the address, in care of a foundation, and they will get a complimentary copy of my book and some scientific information. As Carolyn pointed out, we're eager to have more doctors know about this relationship because there are a lot of people out there that we know that need help.